So hi again, Boone and Trish. So obviously something that's in the news a lot at the moment that a lot of us are receiving letters and emails about are the COVID vaccine. And some of us might have had our first dose, some might have had our second, and some of us might be considering whether or not the vaccine is for us. So Boone, can you tell us what are your top tips for having the vaccine and how to stay well during the vaccination period? Is there anything in particular we need to be cautious about or think about?
Thanks for the question, Mel. I had a particularly important experience in that it was the first vaccine that caused me to feel slightly shivery and unwell for many years. So I've forgotten what it is like to feel so generally unwell with fatigue and the need to sleep for so many hours. So I think the top tip here is don't treat it like a trivial day that you leave your office or workplace and busy environment, go and have the vaccine and then go straight to work with a full-on day for the next day or two. Because I think you should consider the vaccination as something that will trigger an immune response. After all, that's what it's meant to do. And in fact, switch your mindset so that if you feel lousy after the vaccine with feeling hot, cold, shivery, uh, a bit of fatigue and feeling under the weather for 2 days, then switch your mindset and actually consider that a very positive experience. Because if you don't and you fear, and here is one of the things that I'm starting to believe more and more with more clinical experience, which is the deep-seated influence of the autonomic nervous system resides in subconscious, right? Because that autonomic nervous system is part of the involuntary control system that controls your blood pressure, your heart rate. And we now know from our experience with long COVID that patients can develop long COVID in a very in a multitude of ways, and they can have their symptoms continue and persist when they don't pace themselves or when the influence to the autonomic nervous system is fairly negative or adverse. And I think there is a slight dichotomy here, one in which we think the physical therapies, what we normally prescribe, such as adequate fluid, salt, hydration, compression, stockings, are influences and prevent the autonomic nervous system from being expressed due to chronic low blood pressure states. There is a second way to influence that autonomic nervous system, and that's positivity. Because when we are positive, we're not filled with the negative emotions of fear or frustration, then we give the chance to for the autonomic nervous system to express in a positive way. And so, top tips, coming back to the question about vaccination, my top tip would be that you make sure you get a good night's sleep the day before, and you make sure you plan for 2 good nights sleep the day after, because you need to allow your body to fight the infection. And we know sleep is one of the greatest positive mediators of immunity. Wind down or manage your diary so you don't have full-on work in the day or 2 or 3 after. And that includes working from home commitments, childcare, for example. So ensure that you clear the deck and give yourself some resting space. Thirdly, hydrate well. So you need to be eating and hydrating well and give yourself the time and space to be at least optimally filled with optimal blood pressures to be in a good state. And fourthly, and here is where I think Trish and Mel, you both have done this with me. Learn to breathe and breathe yourself to wellness, because one of the things that has become apparent with the autonomic nervous system, which also controls immunity, is that the top-down approach, the one I talked about, where your positive emotions can influence a very positive expression of the autonomic nervous system and therefore immunity. There is also a bottom-up approach where breathing and posture potentially can also influence your autonomic nervous system in a positive way. So effectively taking slow, gentle breaths, and practicing that breathing technique can potentially also help to influence your subconscious brain in a positive way and therefore influence immunity. Now, there's no reason to not do these practices on a daily basis, even without a vaccination, because it's ultimately very good for promoting health. And in patients who have long haul or long COVID, these recommendations I've seen personally help in patients who have those symptoms and can improve with time. So those are my top tips for how to handle your vaccination day or 3.
That's great. Thank you. And if you're interested in learning more about breathing and its effect on the autonomic nervous system, check out our previous webinar, which is on our website. Thanks very much, Boone.
Thank you.